A bunion is a deformity of the big toe. A bunion is identified by an outward-pointing toe and a bump on the inner side of the foot. Pain may develop as the bunion grows. While some bunions are asymptomatic, others become red, swollen, and painful. They can be so painful that you can't put on your shoes or walk. Wearing shoes that do not fit properly or have high heels can aggravate bunions. Bunions are very common, especially in women. This is primarily due to hormonal imbalances interfering with tendon joining and ligament strengthening during pregnancy. With a bunion, you shouldn't wear high heels. The higher the heel, the more weight is distributed to the front of the feet. With limited space, there is no flexing, making it more difficult for feet to accommodate. Although surgery is required to completely remove a bunion, there are things you can do to manage the symptoms of your bunions and prevent them from worsening. So, today we're here to give you 10 tips for avoiding and dealing with bunions. Number 1. Wear the right shoes. Wear appropriate footwear. The toe area of your shoes should be wide, and the heel should be less than 1 to 2 inches. It should also have good support for the arch of your foot. Number 2. Avoid flip-flops. Avoid wearing flip-flops and other shoes with no arch support, because it adds extra pressure on the big toe joint. Number 3. Know your measurements. When purchasing shoes, request that the salesperson measure the length and width of your foot to ensure a proper fit. Number 4. Size shoes by comfort, not by number. Different shoe brands may have different sizing. Always go by what feels good, not by your usual shoe size. Number 5. Use inserts. Use shoe inserts to keep your foot in proper alignment and to support the arch. You can use the kind sold in drugstores or have prescription orthotics made. Number 6. Soak your feet. Soak your feet in warm water with Epsom salt to relieve pain and inflammation. Number 7. Ice your foot. When your bunion becomes sore, apply ice packs to reduce swelling and inflammation. Number 8. Take NSAID pain relievers. To reduce inflammation and pain, take non-steroidal anti-inflammatory drugs such as ibuprofen or naproxen. Number 9. Elevate and rest. Elevate your feet when sitting to reduce swelling and pain. Rest your feet several times throughout the day, especially if you have been on them all day. Number 10. Massage your foot. To keep the tissue soft and the toe flexible, massage your foot and manually move your big toe around. Rolling a tennis ball under your foot is a good way to massage it. You may be at increased risk of getting bunions if you fall into any of these conditions. Bunions run in your family. You have an inflammatory condition, like rheumatoid arthritis. You have a job where you are on your feet a lot. If any of these apply to you or you are developing a bunion, there are things you can do to help prevent or treat bunions. Maintain a healthy body weight. Every step you take puts pressure on your feet due to the weight of your body. If you are overweight, your foot and big toe joint are put under more strain than necessary. The higher the pressure the toe joint is under, the higher the chance of it developing a bunion or becoming inflamed and sore. Care for your feet. Take proper care of your feet. When they are tired or sore, soak them in warm water with Epsom salt. Use a moisturizer to keep them from becoming too dry. Allow someone to massage or rub them on a regular basis. Put them up and rest them at the end of a long day. The better you take care of your feet, the less likely it is that you will get bunions or other problems. According to the Journal of Orthopedic and Sports Physical Therapy, over 64 million people in the United States have bunions. So bunions are extremely common. Some people suffer from a typical bunion may also have Tailors bunion. Unlike typical bunion, Tailors bunions form on the opposite side of the foot, at the base of the small toe expands outward. While Tailors bunions are less common than regular bunions, both, unfortunately, can be painful in similar ways. The bump may begin small but grow larger over time. It can also be painful and red. When your bunion rubs against your shoe, it may become more swollen and inflamed. Doctors aren't sure what causes bunions, but they believe that problems with foot anatomy, such as overpronation, cause your body weight to shift, putting pressure on your big toe joint. The bone moves because of the increased pressure. Doctors believe it is largely tied to genetics. In most cases, having parents or grandparents with this condition increases your chances of having it yourself. The bottom line. You can't guarantee you won't get bunions because they are partially inherited, but there are many things you can do to help prevent them. If you notice that you have a bunion, start using home remedies as soon as possible. You can't get rid of them without surgery, but you can reduce the symptoms and help keep them from worsening. Remember, healthy feet are happy feet. So that's it for today. Before you go, please don't forget to like, subscribe and turn on notifications for our channel, so you never miss what we post next. Thanks so much for watching.